We begin with new hope, though, that the coronavirus curve is starting to shift, it seems. U.S. officials report more than 368,000 cases of the virus, though the real number could be much higher than that. The death toll has reached around 11,000. But as caseloads skyrocket nationwide, Tony, there are potential signs of progress right here in hard-hit New York.
Yeah, they like what they see here in New York. The numbers of new hospitalizations and intensive care admissions are falling, and in addition to that, fewer patients need breathing assistance, though health officials do warn that it is still very early in this trend. Our lead national correspondent, David Begnaud, is near the Comfort, a Navy ship deployed to help New York City hospitals. David, good morning. As if to underscore the risks that these frontline workers take to protect the public, the Comfort's very first coronavirus case, as we understand it, was one of its own workers?
That's true, and that worker is isolated, separated from the rest of the people on the ship for their safety and the workers' safety. Listen, you know, the governor of New York had asked President Trump, can we start bringing COVID patients on the ship, not just non-COVID? And the president has agreed. And patients will not only come from New York, they're going to start coming from New Jersey, which is just right across the river behind me. And that's to help relieve some of the pressure on the New Jersey hospitals, too.
Around the country this morning, some health systems are being pushed to the brink in what could be the most critical week for the coronavirus crisis yet. An EMS coordinator told us that he got an emotional reaction when he helped to bring in emergency staffing at an overwhelmed New Jersey hospital.
There were tears in their eyes, and easily to see because about all you're showing when you're with full protection are your eyes.
In other hot zones like Illinois, they added more than 1,000 cases in a single day, bringing the total there to more than 12,000 cases. In Michigan, the Detroit Free Press reports that the state's largest hospital system has 1,500 workers all showing COVID symptoms. Meanwhile, the Henry Ford Health System in Detroit says at least 700 of its workers have already tested positive. The Army Corps of Engineers is now transforming Detroit's convention center into a 1,000-bed field hospital. It will be one of 22 field hospitals across 18 states.
We hope to be done by the 9th of April, and that includes putting beds into it.
In Pennsylvania, a nursing home reportedly says all 450 of its residents are presumed to be positive. At a long-term care facility in Maryland, 14 deaths have been reported. And at a rehab facility in Virginia, they've lost 28 patients due to the coronavirus.
I think what we've learned over the last month is just how much asymptomatic transmission seems to be contributing to the outbreak.
In New York, military personnel are now treating coronavirus patients at the Javits Convention Center in Manhattan.
We're mobilizing in the same way that we mobilized to go to war.
Around the country, some healthcare workers have told CBS News that their hospitals are warning them not to talk to the media about the lack of personal protective equipment or hazardous work conditions. But Michael Pappas, a resident at Mount Sinai Hospital in New York City, says he believes he has a duty to speak out.
I do not want it to be on my conscience that I didn't speak out about what's going on in these hospitals. I would rather get sick and die knowing that I spoke out, whether or not I'm targeted, whether or not I lose my job.
Strong words from the doctor there. Listen, the governor of New York has extended the stay-at-home order through the end of the month, and he's actually upped the fines for people caught violating that order and not socially distancing to $1,000. That's what you'll pay if you are ticketed by the police. Also, the mayor of New York City is looking at what would happen if the morgues here in the city become overwhelmed. They are not there yet, and there was a wild rumor that bodies would be buried in parks. That is not the case, the state and the city says. They are simply looking at one place in the Bronx, which is an island where bodies could be buried if the morgues are overwhelmed, but we are not there yet. Anthony.
All right, David, thank you.